So this is our June 2022 HESI review. There is this 100-question Kahoots that I have here. Also, all of your professors has sent to you every single week's Kahoot and also the 70-question Kahoot review that I did for my classes this week. I would suggest if you're weak on growth and development, go back to week 2 or 3 and go over those growth and development. Or if it's cardiac, go to week 5. That's why I put them all together in one place. I was trying to give it to you because I know 3 courses, everything is everywhere. So hopefully this is going to help, get you organized and give you the best grades possible. So let's see who's going to win today. 100 questions. Some things you've seen before, or you've seen it written differently. Somebody's got to play in order for the game to work. Thank you, Tammy. Where are you, Jamie?
I'm struggling to log in.
Okay. Come on, who else is going to log in? We need a couple students here in order to do this right. Jessica, you're going to log in? Sharon? Burnside?
I have no idea how to do. I don't know how to do that.
Okay, what you do is go to www.kahoot.it and it will say enter a game pin. And the game pin is right in front of you.
You have to make sure too, because this wasn't explained to me and I didn't know.
Okay, so you have your phone.
You cannot play on the phone.
You need a phone and a computer.
There you go.
So you log in on your phone and then you have your computer, which will show you the colors of which one to push. That's okay, we'll wait. I want you to have the experience of it if you've never done it before. It's actually a lot of fun and my students, in the end, are extremely competitive. Is anybody else trying to get in? Okay. All right, we're just gonna go get started. And I wish you guys luck on your review. And I hope that you get something from all these concepts that I'm going to be showing you today. So I'll multi-select. What are the signs and symptoms of pyloric stenosis? When you see an infant coming into the doctor's office or getting care, one of the things, if they're telling you it's vomiting, you need to ask, tell me about the vomiting. Is it just dribbling or is it going across the room, projectile? Because pyloric stenosis, they can go 10 feet across the room, these little babies. So what would you see? Well, when I hear that little infant is projectile vomiting, I put my hand underneath their abdomen, and the upper mid abdomen, you're going to feel an olive, and you really do. And because they're not getting the fluids, you're going to have decreased urine output. Just makes sense. Another multi-select. Signs of acute respiratory distress in an infant include. One thing I suggest is go back, look at your normal vital signs on children. You all got it the first week. Any class, everybody got it, because you need to know normals to know what is normal and what's not. So when you see an infant who's in respiratory distress, they could be coughing because they're choking, they've got mucus, they can't breathe. Nasal flaring is the big one, and grunting. They're at the end of a breath will just go, eh. And I want you to know that usually grunting is the sign that this child is going to go into respiratory arrest pretty quick. Now, respiratory rate of 52, maybe, but depends on, what's the infant's age? Is it newborn or is it, under 1, like 8 months? 52 could be high, but infants, the young infants are 40 to 60 respiratory rate. A multi-select. When caring for a child, they suddenly go stiff and they have a seizure. What should the nurse do? Walk into the room. So if you suspect a seizure, it's all about safety, okay? Turn the child to the side, pad the side rails, remove any sharp objects in there. And of course, you are going to look at the time of the seizure, what it looks like for the documentation. Good job with that one. A multi-select. What may be a problem seen in an infant after open heart surgery? So remember, if they've had open heart surgery, infants is a congenital heart defect. That means they've got a weak heart to begin with, and we've done surgery. What are you concerned about when we're talking post-operative? And most of all, we're worried about them going into congestive heart failure. How would you know that? Well, you'd see them, they're going to be eating, tiring easily, breathing quickly. They're not going to eat right because they don't have the energy, and you'll see that respiratory distress. And it is congestive heart failure. You wouldn't see a low heart rate, you'd see a high heart rate, trying to pump the blood around because the heart is weak. A young man who has cystic fibrosis wants to have children. How do you respond? And I want you to know, when you're talking about men's cystic fibrosis, you are looking at, is it after a lung transplant or before? Now, before transplant, they will not have children. They don't have vas deferens, which means the sperm can't get there. So after a lung transplant, about a year later, it is said that they are more apt to be able to have children. Women can have children. It's not a problem. It's the men who have the issue. So after a transplant, about a year, then they can get pregnant. I think a lot of them decide to have the transplant because of that reason. An infant with tetralogy of Fallot has a TET spell. What is your priority action? I've seen O2 sats go from 100 down to 10 in 10 seconds, 15 seconds, not long at all. What did I have to do immediately for that infant to get oxygen going around that body? And that's that knee chest. And what it does, it takes the abdominal cavity and the chest cavity pressures, and it changes it, and it can pop over that what's ever covering that pulmonary artery, and then it lets blood flow in there again. And it quickly, again, their sats go from 10 to 100. A multi-select. The nurse should assess the infant with congenital heart disease for which early signs of heart failure? Now we've just discussed it, which is the one that we know is there's something happening here. And it's their heart rate is going to be elevated, right? But they're fatiguing easily. Show slow, rapid breathing. Well, if you're in congenital heart disease and you're in heart failure, your lungs are filling up with fluids. It's going to be fast and shallow, and they're going to be breathing, trying to catch up. And they're not going to have a cough because it's deep into the lungs. So fatigues easily, not eating well, probably losing weight, all of those things, heart failure. Nurse provides instructions to the parents regarding administration of digoxin. How do you know there's need for further instructions? The digoxin is a very potent cardiogenic drug, and it lowers and strengthens the force of contraction, and probably the most popular of all cardiac drugs for children and infants. So if they vomit, you're not going to repeat the dose because you don't know how much went in there, and you can become digitoxic quickly. And maybe as you gave it, they're vomiting. Maybe it's already telling you they're digitoxic. Your child's been playing outside in the field with long grass. What would be a priority? What would you tell the parent they need to do? And again, we're worried about those ticks. So go in, take the ticks and remove them. And if you can't remove all of them, then go to the physician and he can get them removed. A toddler presents with sudden severe abdominal pain. The diaper has currant jelly and bloody stool. What do you think that is? What are those signs and symptoms of? Toddler ages 1 to 3. And it's right at those ages that you see this occur. And it's intussusception. So it's sudden severe. The intestines just telescope, and it's extremely painful because the intestines is full of nerve endings. So it's all of a sudden, and it hurts, and you cannot keep them from crying. Nothing you can do can help until it comes back out. And you see that currant jelly stool? We know that this is intussusception. A 6-month-old infant is placed on thyroid replacements for congenital hypothyroidism. How do you know that it's been effective? The medication, how do you know it's been effective? So we know that a child who's born, who's not stooling, they're going to check for problems with the thyroid gland, because if they don't have thyroid hormone, they're going to be cognitively delayed. Which would be cognitively delayed is if they were not able to roll over. So if they can roll over, we know that they're on the right track. They're doing what they should be doing. So that's how we know that it's been effective. They're where they should be developmentally. An infant should be able to sit unsupported at what age? And this is 8 months. At 8 months, they should be able to sit. At 9 months, they're actually standing up and, crawling, cruising around a couch or a table. 8 months sitting. A multi-select. What assessment would a nurse see with a child who is dehydrated? We know dehydration in children is extremely serious and very dangerous. So we need to know, what are we looking at? How can we determine this quickly so we can give replacement fluids? So one of the big things that really tells me the kid is crying and no tears are coming out. We know they're dehydrated, especially if it's a real cry. That prolonged capillary refill, that urine output's down to nothing. Those are signs that you would see. Elevated heart rate, decreased blood pressure, poor capillary refill, poor skin turgor, dry mucous membranes, crying no tears, decreased urine output. All of that is going to show you. Growth hormones are started on a child. What assessment will show you if the medication's been effective? Growth hormones are that subcutaneous injection that they need to take. Mostly they're given daily. How do you know it's working? And they're growing. Simply as that, they're growing 2 inches. They say it continues until they stop growing less than 1 inch per year, then they stop the hormone. One of the symptoms of rheumatic fever is chorea. How would you tell the parent about these movements? You know, it's very scary. Your child is walking, shuffling gait and falling over as one of the side effects of a strep infection, rheumatic fever. What are you going to tell the parent? They're nervous. So it's going to disappear as we give, the treatment for that strep infection, which has caused rheumatic fever. So it might take a month or 2, but they will eventually disappear when you're doing the treatment. A mother of a 2-month-old is worried because the back of the child's head is flat. What should you tell the mother? I mean, today we know it's back to sleep. We don't put anything in cribs, and it shouldn't be a soft mattress because we want to decrease the amount of SIDS. Now, when they are awake, fully awake and alert, put them on their bellies and they can look around, and their heads and their bones are so soft that it will re-round again and it won't be just flat like the mother's concerned of. Which statement from a parent would be concerning regarding a child diagnosed with croup? Tracheal bronchitis. It's this inflammation in the airway, which is causing this barking cough. Now, if this cough's been going on, the swelling in that oral pharynx is going to be occurring. So if they're having trouble swallowing, we're almost to the point of epiglottitis. That is the scariest thing. Airway is closing up at this point. We know croup is a bark. That's what it's going to be. It is going to be worse at night. You may or may not have a fever with croup. A child has myopia. What would be appropriate for the nurse to tell the teacher? What is myopia? So these children cannot see, so put them in the front of the room so that they'll be able to see the blackboard and see the books or whatever the teacher has so that they can see when they're learning. A multi-select. A child born with a myelomeningocele with sensory and motor deficits must be careful with what? What do you need to really watch and be careful with? Remember, myelomeningocele is the spinal cord, and the meninges born on the outside of the lower back, and it stretches those nerves. Therefore, you can have really decreased sensory motor deficits, lower extremities. You need to watch their bladder, making sure they're urinating, and many of them do get bladder catheterizations, but we have to be extremely careful with latex allergies. Now, aggressive physical therapy, no, we just need to keep the lower limbs moving with just normal physical therapy. It doesn't have to be anything more than that. And their lungs are perfect, so they don't need any extra in pulmonary care. What interventions are needed for an immunosuppressed child that has a platelet count of 10,000? What does that mean, platelet count of 10,000? Platelets of 10,000, they should be 100,000 or more. Platelets are that part of that bleeding profile that stops the which does clotting. So if the platelet counts are really low, you are more apt to have bleeding. So bleeding precautions, no IM injections, watching that CBC, monitoring the gums, the urine, the stool, seeing if they're bleeding, bruising. We're going to be watching all of those things. Platelets of 10,000, you are going to bleed. An infant was seen in the emergency room for a febrile seizure, and the mother asked if her baby has epilepsy. What are you going to tell her? So febrile seizures are really benign. Usually they grow out of them. They usually start about 6 months to 6 years old. And usually after that, they will grow out. The only time it becomes epilepsy if they are having 2 or more unprovoked seizures in one day. And unprovoked means without a fever. So the fever is what caused the seizure, not epilepsy, the brain doing it to itself. An 18-year-old parent wants their child's lab results. What do you tell the mother, the father? So the child is 18 and they're signing consents for themselves. You have to ask permission from that 18-year-old. The 18-year-old can get the results, not the parents. What is palvomazumab Synagist used for? Synagist trade name, palvomazumab is your generic name. And this is your vaccine for RSV, okay? You will see questions, something like that, knowing what some of these medications are. What medicine can be used to treat an infant that is in the acute phase of RSV? Now, yes, we can do Synagist to help prevent it, but that's not acute, okay? So that's not your answer. There's another medicine that actually we give in an aerosol that helps children really with a lot of that mucus going on. And it's this ribavirin, Virazole. That is actually a pink liquid you put in an aerosol, and it's azole, which is a viral medicine, and it's inhaled, okay? Albuterol, that's only for breathing issues. We're talking about treating RSV, and that's Virazole. What is the highest priority for a pre-operative infant with bladder exstrophy? It means the bladder is born on the outside of the lower abdomen. I mean, it still works. It still holds urine. It's still, you're going to urinate the same way. But we are worried about that bladder on the outside of the body. We're worried about infections, absolutely. So make sure it's covered with a sterile dressing, and you, when you're handling it, sterile gloves. A smart 8-year-old wants an insulin pump for their type 1 diabetes. What do you tell them? So it's usually about 10-year-old they do it, unless it's an extremely, extremely smart 8-year-old. You know, you have to be able to troubleshoot the insulin pump. You need to be able to give boluses for blood sugars with this insulin pump. So it depends on the child and how they can handle this equipment. But it is a great thing for children. I've watched them work it, and I'm amazed how they do so well many times. A multi-select. Why would a Lyme test be done on a child? So a Lyme test detects ticks, that if the ticks, and it has given them a condition, and the Lyme test will tell us how we need to do the treatment. Usually it's not an immediate when you have ticks on a child. You have to wait 1 or 2 weeks and then do the test to make sure that they didn't catch Lyme disease from the ticks. A multi-select. What assessment would you see after administering an IV bolus of albumin to a child? You know, I was talking about IV bolus albumin to a child with nephrotic syndrome. You know, you're replacing protein back into the body. And then I'd say, well, give some furosemide after it to push it through, right? What would you see? You're putting extra volume in there. So usually the child is dehydrated. So you're going to see an elevated heart rate with dehydration. So the heart rate comes down and the urine output goes up. You will see decreasing peripheral edema. A male infant is born with epispadias. They cannot circumcise this child. Why? Hypospadias, epispadias. It's either on the top or the bottom of the penis where the hole comes out, not at the end. The urethra is somewhere else. They can't take care of that circumcision, especially in the Jewish faith. This is something that can be very concerning, but they need that foreskin to be able to cover that hole. Using the child's own tissue is the best way. A child is wheeled into the ER leaning forward, drooling, no cough with severe stridor. What would you suspect? The key word in this is drooling, no cough. And it's epiglottitis. Remember, croup untreated continues, the swelling occurs, the epiglottis gets swollen, and now you see epiglottitis, which is an emergency. You cannot get air in and out. A multi-select. To diagnose Duchenne muscular dystrophy in children, an EMG may be done. What teaching do you need to tell the child and the parents? Electromyography that we need to do, and it literally takes little zaps of electrical charges and watches muscles contract and spasm, so we can see if there's weakness there, but there is soreness afterwards. So we need to tell that parent that the soreness is only temporary, you know, and give the child something for that, some ibuprofen or some Tylenol. Another multi-select. What conditions would you suspect on a newborn Down syndrome infant? What do we know about Down syndrome? So Down syndrome children are, many of them, a lot of them have congenital heart disease. Also, they're more susceptible to hypothyroidism. And we know that we need to replace those thyroid hormones for cognitive problems, and we don't want them to get delayed more because of lack of thyroid hormone. But congenital heart disease, they have no problem with the bowel or dysphagia. It is just those two. Child's admitted for persistent vomiting and diarrhea. What assessment is most important? I mean, you're looking for dehydration here. How do you know for sure this child is dehydrated? And that's your pulse, okay? If that heart rate on let's say a 2-year-old child should be about 90 and it's 140, you know how severely dehydrated that child is and how urgent it is to get those fluids replaced and giving boluses. Multi-select. What information would the parents and child need to understand about Infantago Infection? This is a staph infection that skin that children spread in daycare and schools. Now, my grandson had it last fall, and his mother thought he just scratched too much and had a sore, but it got worse and worse. We treat it with that Bactroban ointment and oral antibiotics. It's the only way. You need both of them. It's very, very contagious. And there's little tiny slightened red scars that are there. It's not any thick pigmented things. It's just slightly reddened scars are left with it. And he still has them. Multi-select. What is another word that is used to describe Erythema Infection? This is a viral disease that children get. It is contagious and again, spread through the classroom. You'll see fever. You will see this red, what we call slapped face. It's part of it. And it's also called fifth disease. It is a viral infection. You'll see this big rash on them also. And it just takes time. Viral, treat it, Tylenol, Motrin, fluids, and rest. What is the treatment for pertussis? Now you say pertussis, there's an immunization against it, right? Well, not every child gets immunized. So pertussis is a bacteria and it's all respiratory. So Zithromax. So Zithromax is the treatment for it. And if they're hospitalized, strict respiratory isolation. A multi-select. What are some side effects to watch out for in a child taking antibiotics? Many antibiotics cause vomiting, diarrhea, and abdominal pain. And that's just one of those effects of that antibiotic. They can change the antibiotic or maybe put them on, the child on some probiotics, depending how much that antibiotic is really needed to be given. Because again, you get this child into dehydration. How do you get rid of cradle cap on an infant? So you can wash it with soap and water. You can use mineral oil, moisten it, and then very gently, fine-tooth comb or brush, just brush it after the bath. It's not going to go away in one sitting. It could take a week or two, but it will go. A multi-select. Post-operative abdominal surgery child has an elevated heart rate and respiratory rate. What assessment might you make? What is causing elevated heart rate and respiratory rate? Abdominal surgery, post-op. They're having pain, okay? Post-op abdominal surgery, first of all, suspect that it's pain. Sometimes children won't tell you, but if you see the heart rate, respiratory rate up, you can ask them, are you having pain? And at that point, they might tell you. A mother whose child is undergoing chemotherapy asks the nurse about giving immunizations. What is the response? Can they? I mean, especially when you're talking about live vaccines. So the rule of thumb, they say, after therapy has stopped, it's about at least 6 months afterwards, then they can get their vaccines and the live vaccines again. So it's not just till remission, it's 6 months after that. What can cause rheumatic fever? And this is strep throat. Remember, strep throat causes acute glomerulonephritis too. There's 2 of them. An adolescent girl wants information regarding birth control. What should the nurse do? So you can give an adolescent information and you could give them, handouts about it, not your opinion, only the facts about it. And yes, you can, written and oral information. A multi-select. Child with hemophilia fell down hard on the knee. What's the treatment? Remember, hemophilia, fell down on the knees, probably bleeding in that joint. And we want to protect joints because we want to keep as much activity for that child as we can. And if we allow these joints to get crippled, they're going to end up in a wheelchair. So let's stop that bleeding by rest, ice, contain, and elevate, and maybe give those a missing factor at home. And they do that at home. And again, don't give anything that prolongs bleeding times. NSAIDs and aspirin, and NSAIDs also do cause prolonging of the bleeding times, so be careful. Multi-select. How can you decrease GERD in an infant? Gastroesophageal reflux disease. Infants up to the age of 6 months, they're on breast milk or they're on formula, but they still have reflux, they still spit up. How do we keep that milk still in that tummy? And we were going to burp them frequently, keep their head up. And if we thicken the formula with a little bit of rice cereal, it does hold it, thickens it, and it holds it down. But that burping frequently and not overfeeding and keep them elevated usually will work on these infants. Another multi-select. What is priority information needed during the initial assessment of an infant with 101 fever and a cough? Priority information. Well, if they have a fever and they are coughing, I want to know, are their immunizations up to date? Because pertussis is a cough too, and fever too. So is it that, or is it just an upper respiratory? So I could protect me, protect the child and other children in, around them. Also, what medications, what Tylenol, what Motrin, what antibiotic, what have they been taken? And always, always allergies we need to know. A multi-select. What precautions should be taken for infants born with a myelomeningocele? Remember, that is the meninges in the spinal cord, outpatching, pulling up those nerves, out of the lower extremities, and it's born on the back in this big bubble. So, of course, latex, as soon as they're born, they're on latex allergies before even latex ever touches them. But again, those nerves have been stretched. You probably have pulled some nerves, which they don't feel their bladders being full. So monitor urinary function. And also they don't have that enough strength in the muscles with no nerves to push down to get bowel movements out. So those are the three important things. Now, the myelomeningocele is in the lumbar spine, it has nothing to do with airway. This child might need a ventricular peritoneal shunt because does the fluid, the spinal cord, the cerebral spinal fluid go up and down easy? Sometimes it doesn't, and sometimes these children will need that shunt. Multi-select. A 17-month-old eats with a spoon upside down. Is this normal? It's a toddler, 17-month-old. The dive bomb kids, as I call them. I love toddlers. Number one, why are you concerned, Mom? Why do you feel that this is a problem? Because it is absolutely normal. And the children is just taking the spoon. It's something in the mouth and they're experimenting it in their mouth. It doesn't matter upside down, right side, crooked. They're trying to eat by themselves. This is part of that learning process. There's no neurological deficit here. These children are perfectly normal. They're being toddlers. I'll multi-select. How is juvenile idiopathic arthritis treated? So JIA is all about those joints being attacked by the body, and then they're swelling, they're painful, extremely stiff in the morning time especially. And we treat it, the pain medicine of choice is NSAIDs. And then the steroids, anti-inflammatory, and they put these children on methotrexate. And then sometimes if those don't work, they might put them on Humira or Enbrel or an infusion of some sort, depending on severity of the JIA. A toddler vomits 2 times and is listless and irritable. What do you tell the mother on the phone? The toddler vomited 2 times and is listless and irritable. What does that mean? I've seen children vomit one big one and be dehydrated. It depends. Now, 2 times, listless, irritable, this child's very dehydrated, and they do need to go to the ER so they can be evaluated. Very good. An adolescent status post amputation for osteosarcoma is angry and blaming the parents. Absolutely normal, absolutely normal. You know, they've lost part of their leg. They have to deal with this. And it's a very hard time because adolescents don't really want to need parents, but at this point they do. So they're going to blame them. They're going to get angry at them. It's your fault. A multi-select. How do you assess children's outcomes that are on hypo or hyperpituitarism treatment? So we know that hyper has to do with growth and weight and how big these kids are. So we're going to monitor their height and weight. That's why we take every time a child walks in to an ER doctor's office, we weigh them and we see how tall they are. See if they're growing the way they should. A multi-select. To diagnose congenital heart disease, a child must undergo a cardiac catheterization. What are the risks? So bleeding is the big one, especially in the infants. We will see decreased pulses to those lower extremities because we've put a catheter into those vessels and sometimes there's some inflammation there. There is no fever post-op. And pain in the entry site, not really. It's more of the bleeding and the decreased pulses. A multi-select. Infant with a TE fistula. What should the nurse have at the bedside? Tracheal esophageal fistula, a connection between the trachea and the esophagus. Remember, these children will not be fed. These children will not be fed because there is a connection there between those two areas. And even with reflux, we don't want that to happen. So suction, in case the mouth is full of secretions, get rid of it and elevate the head of the bed. And these children, because they're not going to be able to eat, have their pacifier there so they get normal growth and development by that sucking and self-soothing of that pacifier. How would you promote normal growth and development of an infant with esophageal atresia? I just told you. And that's that pacifier. Very, very important that we do have that there for them. It is comforting. Years ago, they didn't like pacifiers. Well, now they think they're great again. Another multi-select. A child's been having diarrhea for 3 days. What should the nurse assess? What are you assessing for? Giving you a lot of these multi-selects because I want you to think of any answer that could possibly be for diarrhea 3 days. What are you worried about? We're worried about dehydration. And what does dehydration, how do you see it? Elevated heart rate, decreased blood pressure, decreased urine output. So we'll be watching those. Temperature, not really, unless we want to just make sure that that heart rate is not elevated due to a temperature. Maybe, but usually we don't, it's not first. Another multi-select. What assessment finding would you see in a child with cystic fibrosis? So remember, cystic fibrosis is lungs and the small intestines. It's a twofold condition. So we do have that pulmonary congestion. We have those foul smelling stools because they're not digesting the stools the way they should. And because you're not getting nutrition, you're not getting those fat soluble vitamins, there will be growth delays. A multi-select. What assessment would alert the nurse that an infant is in acute respiratory distress? I asked this a little bit earlier. I'm asking it in a little different way now. And we'll see that nasal flaring, but now I put in intercostal retractions for sure and tachypnea for sure. Good job. What symptoms usually bring a child to the doctor and ends up with a diagnosis of acute lymphocytic leukemia? You know, to be diagnosed, you had to have something happen to go to the doctor. And in ALL, you're going to see bone pain, fatigue, and ecchymosis, some bruising that, you know, this child's not playing sports, didn't fall down, and we're bruising and this pain. And that usually will bring them in for treatment, and that's when they find leukemia. A multi-select. When teaching a child about sickle cell disease, a nurse should include what? So if a child is starting to have a fever, need medical attention. These children do have pain, and they usually are given like a Tylenol 2 or 3 for the home. And when they start having pain, they need to take it as soon as they feel it because it can get so severe that nothing's going to help. And hydration is the key in keeping these children from having these sickle cell crises. We know first line treatment sickle cell, we want to dilate those veins and get those cells moving to decrease pain and give the pain medicine. But number one priority, fluids, fluid bolus. A newborn is diagnosed with transposition of great arteries. What is priority treatment? We know that a transposition is when the pulmonary artery and the aorta are switched. So you have systemic circulation and pulmonic. They're not connected. What do I need to do? You need to put them on prostaglandins right now. You do not do an immediate arterial switch operation. These children are usually a week old or more before we do these procedures. It gives them a chance to get a little bit bigger. Prostaglandins connects that fetal circulation and keeps it open, because that opening is kept open by the mother by the secretion of prostaglandins. After birth, mom's not there, so we do have synthetic, and it's a infusion, a slow, continuous infusion of prostaglandins. And then about a week later, we do the treatment of the arterial switch operation. A child goes with sickle cell disease, goes to the ER with severe pain in her left knee. Priority treatment to decrease pain is what? What's your priority treatment in a child in a sickle cell crisis? And we want to give a fluid bolus. We want to dilate those vessels because they're small. Those sickle cells are stuck and they're backing up and it's swelling and becoming painful. It's going into the tissues around it. Dilate the vein with fluid bolus, number one. Number two, heat. That dilates it too. Get it flowing and your pain's going to decrease. Of course, you're going to give pain medicine, but number one, fluids. A multi-select. What is a VP shunt used for? A ventricular peritoneal shunt. And we have it there to drain fluid from the head when it's not draining by itself. Like that myelomeningocele patient, it's not flowing right and it's stuck up in the head and you're having increased pressure. It also is from the hydrocephalus, some conditions. Some children without a myelomeningocele have big heads, fluid just sits in there, can't get out. So it takes this little shunt from the middle of the brain, behind the ear, down the front of the neck and the abdomen, and goes into the belly and slowly drips out extra cerebrospinal fluid and keeps that pressure from building. What would you see with a child with autism? They're going to be sitting in the corner by themselves and they do these repetitive behaviors over and over and over again. They don't like touch, they don't like sound, they don't like to be around people, and they like to be by themselves in their own little minds. A multi-select. An umbilical hernia has become hard and painful. What should you tell the parent to do over the phone? Now, umbilical hernias, usually they're soft, you push them in and out, and that's not a big deal. But if it becomes hard and painful, what are you suspecting here? You're suspecting a strangulated umbilical hernia, which means they've twisted and now that piece of bowel is dying. So tell the parents, don't eat or drink anything. This child needs surgery immediate. It's an emergency. They need to go and have surgery. So go to the doctor, to the emergency room right now. At what age should solid foods be introduced to an infant? And it's at 6 months that we should start introducing them. You know, breastfed mothers are starting to drink more and more and more and more. So we introduce food, or else the mother just can't keep up with it. So at 6 months, that GI tract is more mature. It can absorb the nutrients. And that's when we will start with cereals, fruits, and vegetables, 3 to 5 days in between the introduction of each separate food item. How would the nurse examine a newborn with suspected cryptorchidism? So we want them in a warm room. If we put them in a cold room, the testicles are going to suck up and we're not going to get a great examination. So put them in a warm room and they'll hang and we'll be able to see if the testicles are there. What acid-base imbalance is caused by hyperventilating? It is respiratory alkalosis. I will warn you, there are at least 4 different questions on acid base. Please go back and review those as you go through studying. And also remember, you're a theorist. You're going to have at least 4 questions on them. Those are 2 hints for you. Go back and check and review them. A multi-select. A child has fallen and a stick has scratched their eye. What should you tell the parent and the child to do? We're not going to touch anything about that eye. We're going to take this child, put their fox shield over the eye, they say actually both eyes, and then send them to the pediatric ophthalmologist. If there's something embedded, we can't do anything. If there's something just floating in there, you know, like we see like a little hair, well, that we can get out, but we're not going to pull anything out of the eye. A school-age child has reoccurring dermatitis, eczema. What suggestion would a nurse provide to the parents? The dermatitis is itchy and it can become oozy and scabby, you know, during these crises. So when they have these flares and all of this juicy, itchy flare-ups are occurring, keep them home so that they don't get the infections from the other kids in the school. Hypoallergenic lunches, no. Gloves, no. We're just going to keep them home and then they can prevent them from getting other infections. A multi-select. Why do you give aspirin to a child diagnosed with Kawasaki disease? Kawasaki disease has those big red bright eyes. I call them glow in the dark. They're so red. Once you see it, you'll never forget it. And remember, Kawasaki disease is a vascularitis, and we're really concerned about the coronary arteries. So aspirin is an anti-inflammatory. That's one of the things it is. Also, it thins the blood, so it prevents clots from going on. So that's why we give aspirin to children with Kawasaki. Newborn child has suspected congestive heart failure. What confirms this? So they are tachypnic, and then they have all of this in the middle, centralized cyanosis with the cryon. We know also congestive heart failure, you're going to see tachypnea, tires very easily. You're going to see those things. How do you medically close a patent ductus arteriosus? Now, we knew we kept that open. That's what we had for the transposition. That's fetal circulation, patent ductus arteriosus. We keep it open with prostaglandins. How do we close it? We need something to stop those prostaglandins from being formed. And we do that with indomethacin, okay? Synagist is for RSV. A child post-tonsillectomy is swallowing every 2 minutes. What does a nurse need to assess? We're going to look inside that mouth. Probably bleeding is going on. I've actually seen children go into losing most of their volume and blood coming out with clots from a tonsillectomy. So if they're swallowing, look, so we could get them for treatment and we could cauterize that area and prevent that big bleeding. A child is walking on their tippy toes all the time. What would you tell the parents? Let's say it's a 2-year-old child. They're walking, but they're always on their tippy toes. What is that? Something is going on with this child. If it's all the time, there's something neurological happening. They need to be referred to the neurologist so they can do an examination. It is not normal all the time. How do you treat epistaxis in a child? You take your forefinger and your thumb and you hold it for 10 minutes. If after that they're still bleeding, they need to seek medical attention and lean them forward. A multi-select. What might you see with a child experiencing severe diarrhea? So it's hypokalemia and metabolic acidosis. When we're having diarrhea, we're getting a lot of alkaline out because of all those digestive enzymes in there. It's alkaline. So you become acidotic. And of course, when you're getting diarrhea out, you're losing potassium too. Now, if I was vomiting, I'm getting rid of acid, I'd be metabolic alkalosis. A parent called the nurse to ask what over-the-counter she can give her child that has welts up and down on her arms, and now it's on her neck. So we don't know if something is spreading anaphylactic. Take her to that emergency room and get treat there. Better safe than sorry. What lunch would you choose for a child with celiac disease? Well, what do you know about celiac disease? What do you need to avoid? So it's all about those flour things, the cookies, the sandwich, and the sandwich. So big chicken, very good. Omelet with bacon and ham and, you know, cheese on it. That's a great omelet. I'd like to have that. A multi-select. What treatment should a child in pain with JIA have? How do we treat pain? All of the above. Well, we know NSAIDs is the medicine we take, but when we treat pain, it's just not medicines. We do other stuff too. Some children like hot baths, some children like cold baths. You know, I have rheumatoid arthritis. I like cold. It helps my pain. And children distract them. Turn on a movie, give them an iPad, play a game, do whatever you need to do, and it will take their mind off of it. Highest priority for a child with sickle cell. So if you have a child who has a fever, they need to seek treatment very, very quickly. It's not just the pain. I mean, the pain, of course, but fever, we know something more is going on. They need IV antibiotics and they need it as soon as possible. A mother tells the nurse that her infant's sweat tastes salty. What should the nurse do? Besides call the doctor and let him know. And that we know salty sweat is cystic fibrosis. A multi-select. How do you diagnose hip dysplasia in an infant? So if the hip doesn't go in the socket and it's above, you're going to have a shorter leg. You're going to have that positive ortolani. You're going to hear clicking in those hips. And also, if you turn them over, their buttocks, one's going to be higher than the other two, just like the leg. Nothing with the inward, outward pointing of the legs. It's a fractured hip in an elderly patient. Why do sickle cell patients have enuresis? What is enuresis?
Bedwetting.
Yes, it is. We know one of the things that causes sickle cell crises is dehydration, and those vessels being too small and the sickles get caught, and it will cause that type of pain, that sickle cell crisis. If we keep them hydrated daily all the time, it might cause bedwetting because we are giving them so much fluid to prevent a sickle crisis. What causes acute glomerulonephritis? And again, it's a strep throat, glomerulonephritis and rheumatic fever, both of them. A multi-select. What may be a problem seen after a child has cardiac surgery? We had a similar question in the very beginning of this, asking it in the end to see if you remember. Remember, cardiac surgery, they have a weakened heart. They're going to fatigue easily. They're going to have poor appetites, and they can be in respiratory distress. It could be due to poor cardiac function, and it could be they're going into failure. Very good. A diabetic child is brought into the ER unconscious. Blood sugars are greater than 600. They drew labs. What is the priority treatment? What's the first thing we do with DKA? Number one, bolus them with fluids, okay? Again, fluids, we need to bolus it. We need to dilute that blood sugar. Then we're gonna start a regular insulin drip, a slow continuous drip, and monitor those blood sugars. And we will, as we get those lab values back, we'll be replacing electrolytes as we can. When administering indomethacin to an infant, what is the expected outcome? Well, what is indomethacin used for? We've already gone over that, had a question on it. So an indomethacin is used to close the patent ductus arteriosus. When that PDA is open, you hear like a machine type of murmur going on in there. If we are giving indomethacin and all of a sudden that murmur decreases and disappears, we know the indomethacin has worked and that PDA is closing. So that decreased cardiac murmur is what we want. We want that PDA to close. The parents of a boy with Duchenne muscular dystrophy wants more children. What information should be provided? You know, Duchenne is usually not diagnosed to ages 3 to 7, and we know it's a progressive muscle degeneration. So they want to have another kid. What do they need to know about it? Well, they need to know that it is an inherited X-linked. It's carried by mother, and it is affecting the male children. They need to know and go through genetics, you know, to make an intelligent decision. Do they want to do this again? Take a chance. A multi-select. The behavior by the child should alert the nurse to request a follow-up for a possible autistic spectrum disorder. Which behaviors do you see? So these children, again, those odd repetitive behaviors over and over again. And when you call them, they're in their own little world. They're not going to answer. Again, they don't like lights, they don't like loud noises, and they don't like people. When an infant needs to be on enteral feedings, what can help to promote normal growth and development? Enteral feedings means tube feedings. Maybe it's a premature infant and it's too small and can't suck, swallow, and breathe yet. And this is the one, again, we're going to offer non-nutritive sucking, whether they're not able to due to a condition or because they can't suck, swallow, and breathe, and they're on tube feedings. We still need to promote that sucking, that pacifier. Again, we know pacifiers causes stress relief. It's comfort for an infant. A multi-select. A complex child is complaining of muscle weakness. What would cause this? What are things that causes the muscles to be weak? So there are two electrolytes. When they are low, you're going to see the muscles affected. That's calcium, magnesium. Whenever you see low potassium, calcium, and magnesium, always think of muscle weakness. Also, hypokalemia, we need that potassium. We know they're probably going to have even muscle cramps with low potassium. Chloride has nothing to do with it. A multi-select. When teaching, what teaching should a parent understand about a 4-year-old with a urinary tract infection? So we need to increase fluids, wear cotton underwear, no bubble baths, and get a repeat urine to make sure that that infection has gone away. What is priority treatment for a child with cystic fibrosis to prevent respiratory complications? So we are going to do that vigorous, I call it pulmonary toileting because you want to flush that mucus out, or vigorous chest physiotherapy, those vests that, you know, buzz and remove that secretions and aerosols, because we need to keep those lungs moving because it is sticky goo that sits in there. It's sludge. We need it moving. What is otitis media? It's simply a middle ear infection, period. Treat antibiotics. What would you recommend for a toddler who mostly uses gestures to convey their wishes? Toddler ages 1 to 3. You want to make sure they're hearing so that they can speak. Because when we're talking about they're not talking, we talk about talking, speech, and hearing. They're both connected. So yes, send them for a hearing test. Good. What prophylactic treatment should be given preoperatively with large abdominal surgeries? Prophylactic, what do we want to prevent afterwards? And it's that giving them something for that nausea. They've had these large abdominal surgeries. It's a long time under anesthesia, and their stomachs are still filling with gastric juices. So we want an antiemetic, because vomiting, when you have your tummy with this huge incision, it's going to hurt. So antiemetics, prophylactic. A child with ADHD is out of control and sent to the school nurse. What should she recommend? So we want to send them to the psychologist. Maybe they need medications, or maybe they just need to talk about what's going on, but get them to the psychologist, and then better decisions can be made for that child. An adolescent is asking her mother to stay with her. Why? We know adolescents don't want their parents most of the time. And that she is missing her family. So basically she is regressing, and she's scared, you know, but she's regressing, and she wants her mom there to help her. It's just part of that things that adolescents do go through. And a multi-select. A toddler is noticed drinking soda from a bottle. What should the nurse discuss with this mother? Do we want toddlers drinking soda from a bottle? So we know high caloric can lead to obesity. That sugar in there can have dental caries, and a toddler should be drinking from a cup, not a bottle at this time. And last question. Biopsies are not done before the removal of a Wilms tumor. Why? I mean, how do we know it's cancerous if we don't take a biopsy? Why wouldn't we do one? What do you know about a Wilms tumor? Boys, African American, ages 3 to 5. But just like we don't want to palpate the abdomen because it could put metastasis going into the peritoneum, if we do a biopsy, it's going to do the same thing. So we do not touch it. It would spread those tumor cells. So here we went. Good job, guys. Some of you hung in the whole way. Tammy, number 3, good job. Number 2, Karen. And number 1, J Baby. Number 4, Jamie and Jewel. Good job, guys. You know, it's been a pleasure teaching you all this semester. I appreciate it. I'm glad that you came to my reviews. If you need anything, you can always holler for me. I'm always here, you know, to help. We have sent you all your Kahoots, all of your exam reviews, everything you need to succeed. So I wish you all the best. So go for that 99.99. You can do it.
Thank you.
Thank you.
My pleasure.